Today, over 600,000 knee replacement surgeries take place every year in the U.S. For many, this surgery is the ticket to a more active life, letting them put the daily struggle with severe knee pain behind. While it is most certainly a life-changing event, knee replacement is a big decision that is not without challenges and risks. During each stage before and after surgery, patients face questions, tasks, and considerations for which they will want to be physically and psychologically prepared. From considering surgery to living with an artificial knee, taking the time to get informed will enable you to navigate the process comfortably and with confidence.
The average age of a patient having a knee replacement in the United States is 68 years of age, and that really hasn't changed much in the past decade. Knee problems are very common, and that's something that people should be aware of. And there are a variety of treatments for ailments of the knee.
When it becomes a substantially limiting factor in your life, when you can't go to the grandkids' ball game, when you can't climb the bleachers, then it's time to think about having something done to treat your knee pain.
While the majority of patients undergo total knee replacement, some are candidates for partial knee replacement. Regardless of what procedure is right for you, it is important that you find an orthopedic surgeon who is well-trained and has plenty of experience with knee replacement.
In preparation for knee replacement, it's advisable to be in as good a shape physically as you can. Many of our patients have multiple health issues. You need to try to keep your flexibility and muscle tone so that you can have a rapid recovery after the surgery. Your surgeon or hospital may have a preoperative education program that occurs before you have your total knee replacement.
Once you have carefully chosen a surgeon and prepared for the costs you might incur, it's important to educate yourself about what to expect during the operation, recovery, and rehabilitation periods. If possible, talk to others who have had the surgery and ask questions about what to expect. Recovery and rehabilitation can be painful and challenging and will require hard work and dedication.
We really work on function in the very beginning. Squats, which is just a small sit to stand. Straight leg raises, knee extensions where you're just bending your knee in the air, standing on one leg, balance activities because you've got to be able to balance on one leg in order to walk normally.
For most patients, it takes about 3 months to get back to feeling like yourself. They may feel a little bit lacking in confidence for a while they're recovering from knee surgery, and that's what takes 3 months to really regain so that you're moving around without thinking about the knee.
80% of artificial knee joints last 20 years. It's important to maintain a healthy lifestyle, including keeping your weight down and engaging in the appropriate exercise.
One of the most rewarding and gratifying things for me is to take patients who are unable to walk or barely able to walk, perform a fairly short operation, have them up walking the same day, and then seeing them walk out of the hospital.
It's an adjustment period for the first 6 months, but you'll find that without pain, you're doing a lot better and you're a lot happier person. It's a very successful surgery.
I always stress to patients, the more they know, the more they can learn about knee replacement and the expectations after surgery, the more successful the operation will be.
Knee replacement surgery has the power to change your life. Proper planning can reduce problems and stress and will help ensure that you make good decisions and receive the best care. There are many details involved in preparing for, undergoing, recovering from, and living with the procedure. An understanding of the actions you can take at each stage of the process will help you obtain a healthy and pain-free life.